Hello, I'm Susan Cole.
And I'm Matthew Hodson.
And welcome to aidsmapCHAT, our live broadcast bringing you news about HIV from all around the globe.
We have another fabulous lineup of guests tonight. I think it may be one of our most attractive panels ever. We have Robbie Lawlor. He is redonkulously handsome. He's a former Mr. Gay Ireland, and he's the co-founder of Access to Medicines Ireland. We have Dr. Rageshri Dhairyawan, who is an HIV consultant at Barts Hospital in London, and she's just released a paper which we're dying to talk to her about. And we have a young HIV positive activist from the US, Deandre Moore.
How exciting. Can't wait to speak to our panel. So, Matthew, what's caught your eye in the news around HIV this week?
Well, on Thursday, UNAIDS just released their latest HIV data. Now, it's kind of quite exciting this year, or quite important this year, because this year being they were reporting on the data from 2020. Now, 2020 was the year set to meet the 1990 targets. So that's 90% of all people living with HIV being diagnosed, 90% of those people on treatment, and 90% of those virally suppressed as a result. And when you're virally suppressed, you can't pass the virus on. So that has a huge impact on our ability to prevent HIV. Now, we've known for about 5 years or so that we weren't going to hit those 1990 targets. So this year, this report was the one where we kind of got to see how close we came. Now, obviously, everything's been disrupted by COVID, but the data we've got is that 84% of people around the world have now been diagnosed, and that's pretty darn good. I think it's better than I would have been expecting. And 87% of those are accessing treatment. And of those, 90%, yep, we hit the target there, are virally suppressed, which means they can't pass the virus on. So that's kind of mixed news, I guess. I think what it says is that we haven't got as far as we want to go. We have to be ambitious, but we also have to recognize what the barriers are that remain to accessing testing and accessing treatment. And those are barriers of stigma and discrimination and other legal and human rights and social and gender-related barriers that make people vulnerable to HIV. And so those are the challenges which we now need to address if we are going to finally end this. And we have that target now set for 2030 to end this epidemic. So let's just hope we can push through and get there.
Fingers crossed. Let's hope that we can. And obviously tomorrow is the start of the high-level meeting to end AIDS, where we'll be looking at the progress that we've made and also what we need to do in moving forward in the future. And as you say, tackling inequalities is absolutely key in ending the epidemic, but we also need to consider that it's so important that we put science ahead of ideology when we look at policy, and also have meaningful involvement of people living with HIV. So really excited to hear more about this amazing event.
Absolutely. Shall we? Oh.
Talking about amazing.
Segway Queen.
Shall we bring on former Mr. Gay Ireland, Robbie Lawlor?
Hello.
Hi, Robbie.
Hi, Robbie. My mum is so excited to have you in.
I'm a big fan of your mum, I have to say. I can travel again to have some rum with your mum.
Wonderful.
Right, well, yeah.
Of course.
No, it's just, me and Susan's mum, we've pledged to fight to the death over you. So no, but seriously, let's just talk about your career as a beauty pageant winner. So you actually use your platform both at Mr. Gay Ireland and Mr. Gay World to talk about HIV and HIV stigmas. Is that right?
Yeah, so back in 2012, I was 21 and I got diagnosed with HIV. And back then in Ireland, no one talked about HIV at all. So when I got my diagnosis, I genuinely thought I was the only one in the country who had HIV, because I never talked about it with partners, with my friends. I never seen a campaign for HIV. So I didn't understand how I was getting this. And it was around a year or two after I got diagnosed, I was like, okay, I'm going to have to talk about HIV because HIV rates were raising at the same time. And I was like, I need to break this cycle. If there's no one out there trying to talk about HIV, well then, the science is going to continue, stigma is going to continue, etc. And Mr. Gay Ireland was happening at the time. And to be one of the parts of Mr. Gay Ireland pageant, if you want to call it, was a fundraiser for people on the old HIV drugs who got muscle wasting of the face. We provided the funds for the cosmetic surgery to help refill the face. It's called the Refill Project. So that was a key reason why I wanted to do it. But I wanted to win Mr. Gay Ireland just so I could use that platform to go around to universities to talk about HIV. Now, Mr. Gay Ireland and Mr. Gay Europe and Mr. Gay World, I wasn't out about my status. So I was talking about, like as an ally, essentially, but also as living with HIV. I just talking about HIV and stigma, and it resounded really well. And I was the only one talking about HIV when there was over 27 people in Mr. Gay World talking about issues around the gay community, gay and bi community. So I was happy to be able to represent HIV in some form.
Fabulous. It's extraordinary, isn't it, that out of that group, I mean, HIV, our communities have been so affected by HIV. And yet the stigma is still so great that even when you gather a bunch of people together and say, right, you've got to talk about issues that affect our community. I mean, thank God for you. You were the one who was standing up and doing that. Oh,
yeah. Backstage, I heard people say, like, when we were talking about HIV, they were talking about past participants for HIV, and they were like, oh, they just wanted the sympathy vote or something, And I was like, it really made me not want to talk about it more because I didn't want to, do you know what I mean? I didn't want to, and now thinking back, that's just such a wrong thing, just to live openly with HIV. I'm not looking for sympathy, but I'm here to be proud and to educate and to say you don't have to be in a closet. Do you know what I mean? It should here's how I can educate you, here's how it feels, here's what it's like to be living with HIV. So to hear that was actually quite a little bit damaging at that age, but I was still happy to talk about it. And it was probably one of the motivations behind, I don't want to be that person to hide my status. I want to be, I wish I could go back and be on that stage and say, feck it, I'm positive. Love me.
Absolutely. And soon after, Robbie, you were a campaigner for Youth Stop AIDS. So battling global health inequalities. So what sort of work are you doing now in terms of access to medicines?
Yeah, so my main goal was to overcome HIV stigma, and I knew I could help that through my story and being visible. And when I was going around universities, as Mr. Gay Ireland, Youth Stop AIDS picked me up, which is an amazing organisation in the UK. And that's where I met your son, James Cole. Shout out to him. And I got to meet Brian from Uganda, who also lives with HIV. Now, at the same time, I was on my 6th HIV medication because I went through so many different side effects and I was so young. Yeah, my 6th. And I didn't think of anything. I just took that having this medication was normal, because in Ireland you don't even have to think about it. Everything's free. But when I talked to Brian, he told me about how all his family died of AIDS when we had access to treatment. And I had to do a tour around 17 universities around this country. We had to go, to DFID, Department for International Development, and your UK Parliament to talk about this. And I was just so struck by this. Like, I went into Parliament and I was like, why do I have access to the best treatment? Why am I my access to my 6th? And they don't even have access to 2 in many parts of the world. And they were the older medication that were giving me bad side effects. Just because the country I was born in or the color of my skin does not make me more deserving of medication than Brian does. And when I came home, I just couldn't get it out of my head. And I was like, I need to do something about this. Contribute in any small way I can. And then I looked for organizations in Ireland and nothing was around. So I reached out and I met up with 2 amazing doctors. And through that, we set up Access to Medicines Ireland. And now we're the go-to Access to Medicines group in this country. And we're working so much on access to COVID technologies as well. So yeah, so what I'm saying is, Susan, you and your son are a big inspiration. And it's the reason why I really wanted to work in this world.
Oh,
she's going to be unbearable now. But I mean, because not only are you a beautiful face because you're Mr. Gay Ireland, you're a beautiful soul because you're doing all this work for people all around the world, and that's fantastic. Beautiful voice, and you're doing a podcast. Yes. Well, not a beautiful voice in terms of singing, but in terms of talking non-stop potentially. Yeah. So myself and Veda, who is one of Ireland's best drag queens, who also lives with HIV, and I had an appearance on Tommy Tiernan, which is like
the biggest late night show in Ireland. And after that, Beta came to me and was like, Robbie, we should set up a podcast to platform other voices living with HIV in Ireland, because there are thousands of us living with HIV in this country, and yet I know around 12 willing to be out about their status. 12. And so what we thought was really important was to get the stories out there. Let's provide the stories. So what we do is we have 2 guests on. One kind of a well-known name, whether it's in Ireland or in the HIV world, and then just someone living with HIV in Ireland who may not be well known, and just to hear their stories. And we've done 5 episodes so far. Next week we have Bruce Richmond and Panty, who is like, the Queen of Ireland, to talk about their experience living with HIV, and it's just going so well. And because we're sponsored by Dublin Pride as well, so we're getting lots of promotion out there too. So I really feel like there's a change in Ireland, back from 2012 to hear nothing about HIV, to people asking us, can they be on our podcast to talk about their status? It's just mind blowing. So if you want to listen in, it's Pos Vibe podcast. We have people from Ireland, but also people from all over the world talking about their experience living with HIV.
That sounds fabulous. And I've got to also put in a plug. There's another wonderful podcast called Tell Me About It, which is produced by aidsmap. I think people should listen to both of these podcasts, really.
Oh, what else would you do?
Well, thank you so much for coming on, Robbie.
It was it's always a dream to talk to you too, and I want us on my podcast anytime.
Marvelous.
Yay.
I'll make it a hot date. All right, see you soon.
Thanks, Robbie. Bye. So he's so lovely. Matthew, it's 40 years of HIV now, and I noticed on social media that you had a tweet about it that blew up a little bit. So what are your thoughts?
Well, yeah, so I mean, it's 40 years since the first reported cases of what we now know as AIDS, and it was 5 gay men in LA. I mean, obviously, these weren't the first AIDS cases; they were just the first ones where it was kind of noted, and I think it's important we make that distinction. But I also felt, well, just kind of let's use that opportunity to talk about how much things have changed since those first cases 40 years ago, and particularly about how effective treatment now is, and how treatment can also prevent transmission. So I did just a kind of positive, happy, upbeat tweet about it, which did kind of go quite far. And of course, when you do something like that, and what was really interesting was the responses that you get from it. And lots of people kind of were sharing their stories of, friends and relatives who had died. And I got a message from one guy, and he said, your tweet made me cry. And I was like, oh, well, whatever. And something. And he said, I was just diagnosed 2 days ago. And he said that when he'd been diagnosed, he felt he had no hope, and he was considering ending his life, and that actually seeing that kind of positivity being pushed out there was like kind of really helpful for him. And I mean, obviously he's at the beginning of a very long journey, and I think it really illustrates how an HIV diagnosis is still a really difficult thing, even though we now do have effective treatment, and even though our prospects are so much better. But I think it also emphasizes the importance of getting those really important positive messages that treatment works, that treatment prevents transmission, because I think it does give hope. And I think it's really important that we do it. And, to have people like Robbie be open about their HIV status, it makes a difference. Yeah.
Oh, that's wonderful. So before we both start crying, shall we bring on our next guest, Dr. Rageshri Dhairyawan.
Hello, hi both.
Hi Rageshri, wonderful to have you back on.
Thank you very much. I just wanted to say before we start that thank you both for everything you do to get all those good messages out to people living with HIV. I'm very emotional from what you just said, Matthew, so thank you so much.
Well, thank you. And Rageshri, you've recently published an incredibly important study that's highlighted the health inequalities experienced by people of colour. Can you tell us what you found?
Sure. So we did this study because we saw that in real life that some ethnic groups weren't doing as well as others when it came to staying on treatment and being engaged in care. So we wanted to see, is this something that's happening throughout the UK? So we looked at data from a big UK-wide study called UK Chic, and we looked at data from 12,000 people attending HIV clinics in the UK. And we looked at HIV outcomes in terms of the cascade of care. And what we found when we looked at this group, we had 12,000 patients, of which 4/5 were from ethnic minority groups. And what we found from this data was that people from racially minoritized groups had lower CD4 counts at presentation, so they were presenting later than the white group. The good news from the study was that once they were in care, everyone started treatment quickly and got virally suppressed. But unfortunately, what we did find was that people from racially minoritized groups were more likely to experience viral rebound. So having been suppressed, coming off medication and having a rise in their viral load, and were also less likely to be engaged in care the whole time. So we found that there are obviously some real structural barriers for people from racially minoritized groups to stay in care and stay consistently on treatment. And obviously this is hugely important because we know that if you are not on effective treatment, if you're not in care, the risk of HIV diseases and being unwell from HIV is much higher.
So it's such important work, and I think we've had a better discussion in recent years, I guess. Also, when I say recent years, since last year, because COVID highlighted some of those racial inequities in health so profoundly, that I think the conversation is just more. I hear people talking about it more, and that has to be a good thing. It's something we talk about, certainly in LGBT rights. If you're not counted, you don't count. What action now can be taken to address these health inequities?
Well, we really hope that this data will drive some national change. So first of all, funding. So it's really important that community groups, especially those which serve people of colour, are funded to make sure that they provide peer support, they provide advice on benefits, housing, immigration, etc., to really support people living with HIV from ethnic minority groups. We need to make sure that we're commissioning a wide range of ways to access HIV testing. So we're reaching groups of people who haven't been diagnosed so far. And, I think the conversation will also really hopefully have impact on us as healthcare providers in being more aware of how we work with people living with HIV. And I think it's just really important that we acknowledge that, it's more about than just the person in front of us. We need to think about, it's not that they can't stay on treatment. It's about all the structural issues in their lives and what's going on outside of clinic. Which may be affecting their ability to stay well and stay engaged in care. So it's really important that we are aware of those things, and we should be advocating for social change as well. So I think there's lots that can be done, and hopefully will start to be done.
Fantastic. And Rageshri, an issue that people often raise with me, people of colour, is going to the clinic or seeing a doctor and not actually being believed when we report pain or when we talk about the side effects that we're experiencing. What advice could you give to someone who finds themselves in this position?
I think this is an all too common problem, unfortunately. And even in my own personal experience, I've had issues around, being believed regarding pain relief. So I think I think healthcare professionals are becoming increasingly aware that there is a big power imbalance between us and the patients that we see. So I think that there are several things that people can do when they attend their clinic. So the first thing is being prepared. So I always tell patients to come with a list, because it's always really easy to forget what you want to say. So come with a list, and if you can, bring someone you trust with you who will be there to fill in the gaps and advocate for you where possible. So I think those are really, really important things. And for example, if English perhaps isn't your first language, do insist on an interpreter. All clinics have access to interpreters, and they should be used more often. And if you're not getting anywhere, then you can ask for a second opinion. There's more than one HIV clinician at each clinic, and don't be afraid to ask for one. We're not offended if someone wants a second opinion.
That's
wonderful.
Fabulous advice. Thank you so much, Rageshri. It's so wonderful to have you on the show.
Oh, thank you for inviting me.
Rageshri.
Bye.
Bye.
So, Susan, what news stories have caught your eye this week?
Well, it's actually very interesting that Rageshri raised the issue of why people may not be adhering to their medication, because a story that really caught my eye was on aidsmap, that great website.
So good, so good.
It's about adolescents in Kenya, and the fact that trauma was a really significant reason why these young people were lost to follow-up and weren't adhering in terms of staying in care. And it's really not surprising that their experiences of trauma was having a really awful impact on their mental health, because some of the issues that were covered in this report were things like sexual assault and gender-based violence and death of a parent. So, I'm not surprised to hear about this impact, but I think it's crucially important that healthcare providers listen properly to young people, engage with young people properly about their experiences, and that the care that they receive takes the trauma into consideration when doctors are working with them. I mean, we talk a lot about health inequalities, but young people living with HIV globally are just the impact in terms of inequalities is just absolutely shocking.
Yeah, I mean, we absolutely see this, that we've seen real declines in the death rates amongst adults and declines in the death rates amongst, kind of really young children. But amongst adolescents, there hasn't been a decline in death rates. So this needs to be addressed urgently. Yeah, absolutely. Absolutely. Shall we bring on our final guest?
Absolutely.
Our final guest it's Deondre B. Moore. Hi, Deondre. How are you?
Hi, Deandre.
Hi. How are you guys? How are you all doing?
Yeah,
It's been emotional so far.
I see it has. I've thoroughly enjoyed listening to the other panelists this morning and morning here where I am. So it's awesome. It's a great way to start my day.
So where are you, Deondre?
I'm currently in Colorado. I'll be going back home to Texas. Texas is where I live. Spent the weekend up in the mountains, just getting away for some time. So it's about 11:20 here a.m. Yeah. So
brilliant. Deondre, we heard from Rageshri about the health inequalities experienced by people of colour in the UK. It seems to me often fueled by systemic racism. I wanted to hear from you about the experience in the USA.
yeah, for sure. I think that a lot of great points were made this morning from what I heard. There's a lot of inequalities that people of color go through here in the US that hinder folks who are living with HIV from getting access to quality healthcare and treatment that they need. It's also a hindrance in which why we see some folks who are still not yet able to reach viral suppression, or what we know as to being undetectable, or U equals U, which is undetectable equals untransmittable, which means that a person living with HIV who is on their HIV treatments and maintaining a virally suppressed viral load cannot sexually transmit the virus to their partners. In the US, there are about 400,000 people who are living with HIV who are not yet virally suppressed due to what we consider to be social determinants of health, which might be, which is going to be like homelessness, poverty. We include systematic racism, homophobia, transphobia, xenophobia. There are various factors that weigh in that disproportionately affect people of color who are living with HIV to hinder them from not getting the quality healthcare and treatment that they need.
We've been talking about kind of being diagnosed, because you were diagnosed. Also, you were very young, weren't you? You were 19.
19. I was a freshman in college. Yes.
How did that hit you at the time?
Oh my gosh, I was still a baby. I didn't know anything. It was a scary time for me. It was very, very scary. I was alone. I was at the university, so I wasn't with my family, and I'm a very, very big family person. I'm a mama's boy. And so unfortunately, I wasn't with mom at the time, but my first thought was I got to go home. And so that's what I did. After the doctor gave me my diagnosis, like, he was handing me some paperwork. Don't even remember what was all on it. Just grabbed it and got in the car and left. I had college midterms that day, didn't care, got on the road, just drove those 3 hours back home. And it was crazy because I had just left home the day before for Easter. And so we were celebrating Easter here. And so it was a holiday, and just had to take that drive back. Just had to get home.
And what's wonderful about your story is you've taken that experience and you've become so powerful with it. You're now working with the Prevention Access Campaign, which is kind of the group which are really pushing the U=U message, which is like so very dear to my heart.
Yeah.
What do you think that the biggest barriers are to getting that message out to audiences around the world?
The biggest barrier to getting just the message out itself, I will say, has been the somewhat of the buy-in from folks who work in the field, who somewhat have a slow change to adapt to new things and new terminologies and innovative ways in which we see HIV. The issue with seeing folks who are actually able to attain or reach viral suppression and be able to be undetectable has been what we just talked about, the inequalities that people of color face, specifically across the US here.
Yeah. Deandre, it's been fantastic to meet you at long last and to speak with you.
Yes.
Thank you so much for coming on the show.
It's been a pleasure.
Wonderful
Thank
to
you all
have you
so
on.
much. Yay. Thank you.
you. Bye.
I mean, of course, there is that other thing from the UNAIDS data is that actually, adding it up, it's about 1 in 4 people living with HIV around the world still are not accessing that HIV treatment, which can save lives, will save lives if they access it, and also prevents transmission. And, we've got so far, but let's just end this. Let's just end this.
Absolutely.
Anyway.
And it's at a time when we need to ramp up the efforts. It's absolutely shocking to hear that our government is looking to decrease funding to UNAIDS by over 80%. And the impact's going to be absolutely devastating. Yeah,
I mean, this last year has, of course, been, really terrifically difficult for everyone. It's read earlier on someone saying, we may all be in the same storm, but we're not in the same ship. And I think that's really true. And I just feel like right now we just need to maintain that momentum in terms of access to HIV treatment, which has been the theme with kind of all of our guests. Make sure that everyone has access to treatment, access to testing, and irrespective of skin color, irrespective of ability to pay, irrespective of sexuality or gender identity. I mean, it's just, now is not the time to pause. Now is not the time to defund this work. It's so important.
Absolutely. And now may not be the time to pause in terms of the global fight against AIDS. However, it looks like now is the time to end this episode. So a huge thank you to our 3 incredible guests for coming on. This has been a wonderful episode. They're all so inspirational.
Yes, thank you, Rageshri. Thank you, Deondre. Thank you, Robbie. So great to have you all on. Thank you to our sponsors, Theratech and Lloyd's Pharmacy. Thank you to all the crew at Disruptive. Thank you, Susan.
Thank you, Matthew.
Yeah.
And we will be back in 2 weeks' time with another exciting episode of aidsmapCHAT.
And the week after that, there's going to be a Pride special. Woo!
That's going to be really great. So see you all soon. Bye, everyone.
Bye.